Differences among information organizations. For this project, we collected qualitative data from 12 incredibly unique information organizations. These institutions ranged in size, some having a staff of one person, and others having a staff of thousands. They also ranged in type. Medical and music libraries, corporate technology institutions, library consortiums, and academic, school, and public libraries were all represented in our interviews. When the COVID-19 pandemic began, many information organizations made the tough decisions to close their doors to the public. As a result, many libraries faced similar situations regarding patron access, as well as the safety to the public and library staff. As libraries began experiencing an increase in the demand for digital resources, internet access, and technology assistance, many libraries began offering curbside services, mobile libraries, and computer lab access by appointment. Several libraries also implemented parking lot-wide Wi-Fi access, extended item due dates, and increased library fine checkout limits. Libraries also found ways to serve the public virtually. Public libraries began hosting virtual events such as story times, book clubs, game nights, book sales, and craft shows that were conducted through Zoom or Facebook Live. Several libraries also implemented virtual services such as tip lines, chat with a librarian services, and wireless printing. These services allowed patrons to access library services while staying safe at home. As restrictions were lifted, many libraries, like the Clarkston Independence District Library, slowly began opening their doors back to the public using a phase-level approach. These plans particularly consisted of 1 to 6 phases that involved different levels of restrictions pertaining to the public's access to library services. Using this approach, libraries and similar information organizations created their own plan for reopening to the public. But public, school, and academic libraries aren't the only information organizations. Jennifer Barlow, a clinical librarian with Ascension Borghese Hospital, noted that some of her peers lost library space for temporary COVID labs or patient space. After being 100% virtual until recently, she has her space back. But not all hospital libraries had their spaces returned to them. Organizations like DollNet or the Library Network moved work from in-office to 100% virtual while they continued to serve the libraries that are a part of their organizations. While the libraries that they served saw huge changes, these networks were already flexible because of the nature of their work and focused efforts on helping their libraries adapt. Some organizations have been 100% virtual since before COVID restrictions and were not likely to see major changes in day-to-day operations. Rich Tatum, SEO strategy manager of Edgy Labs, explained how COVID-19 affected individuals in the organization and the effect that it had on the company, saying, quote, "Deadlines have slipped, simple reminders have been overlooked, communication has declined, which is a mission critical for remote staff, and daily stand-up meetings have been skipped on a few occasions. Community is hard to define in a remote workspace, but coworkers appear cheerful, energetic, and optimistic, at least until they're suddenly not." End quote. One difference found was in how organizations framed their beliefs around service or innovation. In some ways, these values are two sides of the same coin. While all these organizations have placed an emphasis on improvement, some have focused that improvement outward. They improve through serving the community, the public, or the poor and vulnerable. Others focus that goal of improvement inward, striving to be constantly improving themselves. These differences were not divided along organization type. There were library networks, public universities, and private businesses on each side of this division, showing that these are truly unique differences, personal to each institution, and not based on what population is being served. Another unique pattern that appeared among these organizations was a difference in how each institution framed their values in terms of diversity or in terms of community. Again, these opposite viewpoints played against one another, showing either an external view of including everyone or an internal view of preserving identity. It makes sense that organization type would play a role in these values. All the institutions that place a value on diversity are public, academic, or network organizations that serve a wide population and focus on giving them access to as many services and forms of knowledge as possible. However, the organizations that focused on community, even if they do serve everyone, each focus on a specific population. The Tribal Library serves the Saginaw Chippewa Indian Tribe members, and the Library of Congress is specific to the American people. It would make sense that each of these organizations would focus their values on preserving and sharing the culture and history of their specific community. The last set of differences that stood out from our data collection on core values was a difference in privacy versus collaboration. Privacy and collaboration are not necessarily opposites. A library with a focus on collaborating with others might very well also highly value the privacy of its patrons, and vice versa. However, there was a consistent pattern in which of these two values institutions chose to focus on. It shows that some institutions focus on individual concerns like privacy protections first. Meanwhile, others' first instinct is to think communally about collaborating with others and working in large, interdependent groups. Information professionals can be divided into two basic categories: those that serve the general public and those that serve specific populations. The general public information professionals are usually found in public libraries. Those who serve specific populations are usually associated either with healthcare or college and university level educations, or they serve private entities who are only connected to the public through individual work contracts. There are also some entities which fall between, serving the general public and also serving specific populations. The Saginaw Chippewa Tribal Libraries is one such entity. According to an interview with Ann Heidemann, it was built initially to serve the local tribe, but it also serves the general public, as everyone is eligible to get a library card with the tribal libraries. Information professionals serve a wide variety of populations, both public and private. Many have restricted access in one form or another, which limits use to those specific patrons. The private entities have the most restricted access to their materials, which limits who in the company can see what data and specifically excludes the public. School library materials are generally limited for use of their students and staff in the same manner that medical libraries are often limited to clinical staff and other employees, along with patients and their visiting family members. While academic and tribal libraries, as well as the Library of Congress, were designed to serve specific populations, they are also open to the public for some services and access to materials. Public libraries have the most open access, with all materials being available to anyone who visits the library. Public libraries are open for public use and only limit who can check out materials.